Okay, this is a follow-up on our last blog post on the rotator cuff of the hip. So very similar to the rotator cuff of the shoulder. Ball and socket joint. The rotator cuff is responsible for keeping the head of the femur into the socket of the hip, just like the rotator cuff for the shoulder. It keeps the head of the humerus in the socket of the shoulder blade, all right? Those that haven't seen an anatomy picture of this before, but this is the pelvis, not the best example of one. Here's the hip. Of course, this is not the femur, but a weight here. You can see how that ball is going to rotate side to side in that socket, okay? The muscles that we're talking about, as far as the rotator cuff of the hip, are muscles that start up on the back of the pelvis and go down and insert at different points onto the femur, okay? And those muscles, if they're weak, will cause a rotatory instability or cause hip snapping because there's some sort of imbalance in the muscular system itself. So what we want to do is show you a couple exercises to get working on rotational stability. This is all actually in addition to the stuff that you probably learned already for strengthening your abductors and strengthening your glutes and strengthening your hamstrings, especially if you've come to see us before. This is in addition to that. It's to simply work on the rotational stability aspect of that rotator cuff of your hip. So first option, I'll give you three options here. So cross your right leg over your left. So someplace 45 to 60 degrees of bend in the hip, and then I'm going to instruct Laura here to raise her foot towards her, like she's trying to lift that leg off of the leg that she just had it on. So hold 5 to 10 seconds, and then back down. And then follow that with an isometric contraction of the external rotator. So as she comes up like this, well, she's actually strengthening the external rotators this way. When she goes down, pushes the outside of her shin on the end of her thigh, that's an isometric contraction of the internal rotators, okay? So same thing, start with 5 seconds, work your way up to 10 seconds. 10 to 15 times each direction. Another option, lay down the side here. We're gonna start with internal rotation for this, all right? So let's do the internal rotation motion there. Try to keep this part of your body still as you rotate out. Hold 1, 2, 3, 4, 5, and then take this foot, place it up and buttress it against the inside of the other foot, and then follow with an isometric contraction into external rotation. Okay, just make sure you don't torque your shoe there. Yep. Okay, so same thing, 5 seconds, 5 to 10 seconds, 10 to 15 times each. And then last option, let's have you sit on up. This one's a little tougher, especially if you have any back history. Let's have Laura lean back a little bit. Try to do like more of kind of a flat back bend. Try to keep your back straight. Cross one leg over the other one. All right, and this is hard. You try to raise your foot straight up like you're trying to rotate up and in. 1, 2, 3, 4, 5, then back down. Follow with the isometric contraction, pushing out, which is internal rotation. All right. Good luck with those. Thanks.